definitions, and inclusion has many different definitions and might be included, might be sort of understood differently. So for us, really, inclusion is about working together. And you can see a picture of our lovely team. It's about working together, having a mix of people with disabilities and neurodivergency and from different ethnic backgrounds, and when men and women, multi-sectional, but generally working together. Because for me, the most important bit is about that collaboration. So what you see in that picture and inclusion, when I think inclusion, it means working together in every single space, in every single setting. So not only in policy, but also in practice. So if we move to the next slide, please. So as our RICS approach, so how do we do it? How can we make sure that we can work together with people? And so we base our approach on a set of principles. And so the principles you can see on the slide is the person-centered. They are all set of principles. You can see there's nothing sort of new, and people talk about person-centered, student-centered, user-centered. It's a very commonly used term. But what we're trying to really understand and practice is think, what does it really mean, person-centered? So it means working together. Okay, we know that. It means learning from each other, but it also means that this person at the center needs to be actively involved. And when we say actively involved, and then I look at different practices when I go to meetings that are about inclusion, or look at universities or classes and meetings and teams, I might see there is some representation, but they're not necessarily actively involved. So actively involved means that the person is, at the center of this sort of process. And looking at that, and when we started our work back in 2004, I remember bringing in people with disabilities and staff members to work together on the person-centered plans, looking at what they're going to plan. And what I noticed, that the staff were in control and in charge. The person with disabilities were not really actively engaged and involved. The power was very much with the staff member. So we then look, okay, so what is it about self-advocacy that the person, what is the research telling us? So we looked at research, we looked at different reviews and literature reviews around self-advocacy. And what we found, really interesting paper by David Test from North Carolina University, and with his colleague, they did a review of literature, and what they find that self-advocacy skills do not come naturally. They need to be learned and taught. And there is a framework that they developed, which had knowledge of self, knowledge of rights, communication, and leadership. So, it's all well and good to say, let's work together at the person actively involved at the center, but actually we need to now think how we can help people to develop their self-advocacy skills. So again, our approach is person-centered, then this multimedia self-advocacy. So we added the multimedia. I wrote a paper back in 2012 about this, where you sort of understand that people with disabilities or learning difficulties might have difficulties in communicating. So using media and multimedia can really help and enhance the communication, reinforce the memories, and help them to communicate things more effectively and clearly. So hence we called it multimedia self-advocacy with the use of multimedia. So another principles that we really need in order to work well and in a truly person-centered or student-centered way, we need to think about the universal design for learning, but also universal design applied more specifically in environments. And so universal design for learning, I'm sure everybody sort of knows or heard about this, hopefully. If not, it's the set of principles that came from universal design. It was about removing barriers to people who are at the edges of the society. So those who have the biggest barriers and those who have the least barriers. And if we do this research to the edges, then we are likely to address all the barriers that everybody else in the middle has as well. And so universal design design for learning, they have a set of principles that mean that we need to provide multiple means of representation, multiple means of action and expression, and multiple means of engagement for our students. And that needs to be designed and implemented in policies for the universities, but also in practice. So, again, the policy exists, but in practice, there is still a lot of work that we need to do. So, for example, we can see universal design principle and thinking in the classroom where I go and teach at universities, so our university or others, and I can see that people have made some adjustments by providing, for example, a raising table. But that raising table is stuck at the back of the room somewhere, not even plugged to the wall, so it's not useful at all. But there was a tick. Yes, university have provided all these adjustments for people. But that's the example of universal design. So you can see where we are, but there is still way to go. Next part of principles that we looked at and that we apply in our inclusive research is this inclusive practice developed by Jan Wandsley back in 2011. She talked about inclusive research and what it means by involving people with learning disabilities as co-researchers, and again, actively involved in all stages of research projects. So from the early inception of the project, thinking about the research questions and being involved throughout every single stage of the process, including the publication. And we use our RIX Wiki, RIX software that I will show in a moment, to do that, to enable people to be actively engaged and involved. So we constantly think, how can we, what adjustments can we make to make it better for people? And the last sort of principles are about action research. So we are using action-based research, which is quite, for academics, it's quite, can be quite unnerving because it's an unknown. When you're going and doing an action-based research, you don't go with your own agendas, you genuinely want to find out from people. So you have to sometimes think on your feet and be in this vulnerable position. But I see this as a positive thing because people with disabilities often feel like this. So we start sharing the powers, sharing the anxieties, and we start working together. And in the process, we are able to develop and design things that are truly, inclusive and truly person-centered. So if we move to the next slide, please. So, like I said, for RIX, we are a team. We are co-producing. We're thinking about the spaces, the products and services. So, in terms of spaces, yes, raising desks, universally designed places that you can move furniture. And in our office, that's certainly the case. But it's all about co-production. And but we help to design and spaces, products and services and teaching and learning. And so some of the products that we have developed are our software. We have RIX Easy Survey that you can see here, the RIX Hackathon 25. So that's an example of our Easy Survey. And then on the top is a RIX Wiki. And RIX Wiki is an accessible online passport protected tool that people can use for research, for example. They can use it to monitor and to capture every stage of the research, and is designed with people with disabilities. So all our co-researchers are able to take part and monitor and understand what actually this research is all about, what the papers we are writing, because every single meeting, every single discussion is recorded in multimedia format, and people with disabilities are doing it themselves. And so if you move to the next slide, because I'm aware of the time, there's a very short video you can watch a little bit. The tool that we have, we use it, and we developed this as part of co-production, obviously, and we use it with various, not only ourselves, but lots of schools are using it, and individuals and families. So if we play a little bit of that video for us, please.
At Charlton Park Academy, we believe in trying new technologies, new software in order to open doors for our young people. One of the key developments due to the SEND reforms has been the introduction of RIX Wikis and the technology for self-advocacy across the whole academy.
If a person goes on the wiki, they can put anything, whatever on there. They can just design it, whatever they put on there, you can show to your friends, family, and other people, and it's fairly easy to use.
A lot of our young people have really complex communication needs, so the wiki is a simple an easy to use platform, which means that our most profoundly disabled young people can actually use this equipment and the software, as well as the more articulate and more able.
What did you like best? Adding on your friends, yeah? Okay. Can you have a look on there?
Moving from the child, then through to the parents, as well as the team of multidisciplinary professionals around, it does mean that we get a full picture about what everyone thinks about the young person.
Can we move to the next slide?
Shane, as his annual review, uses his
So we work in partnership, like I said, with lots of different people, and including policy organizations and other universities, and we work together in this inclusive sort of way. We're organizing summer schools, hackathons, and research projects, and teaching and learning developing programs for students with disabilities as well as the neurotypical students. And if we move to the next slide. So, for example, here we have an example from, we had the summer school. Again, the fact that we were holding a summer, as far as we know, the only summer school available for travel abroad students with disabilities. The study abroad is very common, but for students with disabilities is often a barrier because of the additional needs that they will have, and the organizations may not be able to have these accommodations. But because our campus is designed and developed, and we, constantly trying to improve it to make sure that we can hold people and welcome people with a range of disabilities. We have a changing places toilet, for example, next to our office. We also have 15 accessible rooms at the university. But by welcoming students with these disabilities, we are always doing a research. So it's always part of it is reflecting and looking what's working, what's not working. So we were able to find out there was a problem with accessible rooms, and we found a solution. But again, let's move on to the next slide, please, because there's one more video that I wanted to show as well. And this is like a very lovely quote that we use, that what we see changes what we know, and what we know changes what we see. So by involving and working with people with disabilities, we actually start to see other barriers and people see, and we're starting to understand, and see differently. So afterwards. So if you go to the next slide, please. Sorry for rushing. So this is one of the barriers that the person with disabilities mentioned, and this was inaccessible room. And you can see there's a bit of a wedge going into the bathroom. And so they've mentioned this to us only because we were focusing on inclusion, and told us, well, actually, we didn't mention before because we used to it, and we have to, this person had 2 carers, and they said, oh, we just have to lift the hoist, because this person was using a mobile hoist to transfer to the bathroom. We need to lift the hoist to help the person to get in. And we, straight away developed this simple solution, as you can see here, 3D printed, and that meant that the person can get in. The problem that was here is that we have 15 bathrooms. They are designed based on the standard. So what we identified here, that the standards are wrong. So we are now looking into the standards and influencing policy and changing those standards so they are truly accessible. So this is what I mean. If we didn't have that person on that course, on that study abroad, we would not have done this. So that's thanks to that inclusive practice. And that's really what all the whole production is all about. So if we move to the next slide, and we will watch a little bit of that, and I'll finish there because I'm aware of the time. But if we watch just a little bit of this, so you can see this is how we start our research projects, have inclusive hackathons where people come in all together and we work and we find out from each other what the problems are.
It's been revolutionary. I've been telling other people I've never seen so many other people with physical disabilities in one places. And not only that, those that are being respected and listened to on equal footing with those with able bodies.
Coming in, I didn't know what to expect. I've never been to a hackathon. I've honestly never heard of what that was. But I've really enjoyed it so far. I found it super collaborative and super inclusive.
Being able to listen to diverse perspectives and voices from people of different walks of life, especially within the disabled and neurodivergent communities.
Today we
invited over 100 people, all from different walks of life.
We've had people from different countries flying in just to be part of the event today. We've had people from different walks of life as well and different experiences, and that's what makes this event so special, because you get that difference in the solutions that the teams come up with.
What I did notice from like the get-go this year is that it's huge, it's expanded. There was bums in seats, like every single seat was taken.
Such an amazing opportunity, certainly from our perspective, for our students to come and meet local communities.
Today has really been eye-opening. It's something I've never experienced before. To see everybody coming together for one cause and for a reason is really, really refreshing.
We learn every time we do an inclusive hackathon how to make.
Yeah, I'm just aware that I've sort of went over time, so I stopped there. Apologies. And we can discuss or have questions afterwards. Thank you.
Thank you so much, Gosha. That's, I mean, what a fantastic and inspiring presentation. Just to know, how University of East London has put really adapted their practices and really made this person-centered approach, which you've really illustrated quite well. And I learned quite a bit in terms of, what the research is showing, but how you've been working with partners to really put that into practice and realize impact. Yeah, really, really interesting work at your university. I will move on to the next presentation, and that's by Caroline Eck-Ruckert, who's based at Griffith University in Australia. And she leads a whole of institutional approach or strategy to embed equity, inclusion, and career readiness across the student experience. Caroline brings over 10 years of senior leadership experience in higher education, including roles as Director of Student Success at QUT and Program Director for First Year Initiatives at the University of British Columbia in Canada. She's led large-scale cross-institutional initiatives based on student retention, engagement, and employability. Caroline's work centers on co-creating educational ecosystems that connect students, staff, and communities through shared purpose, mutual learning, and collective responsibility. A longtime advocate for partnership-driven approaches, Caroline is committed to fostering ethical, place-based, and socially responsive education that supports more just and sustainable futures. So over to you, Caroline.
Fantastic. Thank you so much, and it's lovely to be here. It's heading towards evening here, so we're on the other end of the day. I'm really delighted and excited to share with you a little bit about Griffith University's journey around reimagining disability through an inclusive futures lens, and how that inclusive futures lens has shaped not just what we do here at Griffith, but that it's also shaping fundamentally how we work and who we work alongside with. One of the things at Griffith is that when we think about disability inclusion, it's not just a conversation that's happening, but it is actually inclusion is the core conversation that drives our university's mission. We are a university that seeks at its core to create a brighter future for all, so that inclusion is built into the DNA of our identity. And that's been really significant for us, because when we think about the work of reimagining disability, a couple of things that we've really that have been really at the center. The first is that we are a university that takes our situatedness in place as a core driver of our work. And so when we are thinking about the work of reimagining disability, we wanted a place-based approach that's really responsive to the unique challenges of our region and of Australia more broadly. We wanted a partnership-driven approach around the co-design. Again, there'll be a lot of synergies with what Garcia said. But also, really importantly, we needed an approach that would align to our values, our core values as a university. And our core values are centered in seeing inclusion not through the lens of simply tackling structural barriers and historical inequities, but really seeing it through the lens of inclusive excellence, and really that if we can create an inclusive environment, that is one of the most powerful levers we have to really uplift our whole community and our whole sector. So what I want to talk about, next slide, is I want to talk about the multi-pronged approach that Griffith has taken. Next slide, please. And looking at, I'm going to pull out a few pieces of work that we've done. So next slide, please. One of the key things we recognized is if we wanted to have an approach that was truly place-based, one of the core priorities for us has been that we needed to establish an infrastructure to support that place-based work. And so one of the first things that we've done as a university is in 2022, we established an Inclusive Futures Beacon, which was an interdisciplinary research alliance that brought together people with disability, researchers, industry, government, and health practitioners. And the goal was for that collective, and we're now over 300 strong, to really come together. And we were driven by, again, you'll hear a lot of synergies with Gossia's work, but the core principles that were driving the work of the Beacon were one, a commitment to universal design. And ensuring that solutions were accessible, not just for a single cohort, but accessible for a broader cohort of humans. Similar to Gossia, we also use, as part of the Beacon, good user-centered user experience design processes, because we want solutions that are created with and for community. Also really important, and this is really significant around the place-based, is that we wanted to also work with community to identify the problems and the challenges that are of most importance to our region and to our community. There are a lot of challenges that we need to tackle, but we really wanted to work with community to really hone in on the problems worth solving. And importantly, we also wanted to activate the capacity of our citizens to not just participate in design, but to actually build the capability to be designers and to be researchers. And again, that's something that's quite unique to our approach. In terms of the work of the Inclusive Beacon, I talked about the importance of place. That's been really center to the work at Griffith, and we've identified 3 core themes that drive the work of the Beacon. The first is within Brisbane and within Australia, our commitment to creating healthy, safe, and accessible environments around housing and transportation. So a lot of our research is honed. The second priority was building sustainable employment pathways and inclusive workplaces. So again, how do we uplift and create inclusion through work? And then we're really excited in Brisbane to be hosting the 2032 Paralympic Games. And again, the Inclusive Beacon has a strong focus on promoting inclusive sport, recreation, and access to healthy environments. So again, for us, it wasn't just about doing the work, but really about understanding how does our place shape the work that we do and how we think about the work. So that's the first bit, is establishing that ecosystem of partners and really needing an interdisciplinary approach. The second piece, next slide, that we recognized was it wasn't just about identifying the different expertise sets that we needed to bring together, but it was also ensuring that we were rethinking how we did the work. And one of the key things is we recognized that we wanted to take an approach where there wasn't going to be a one-size-fits-all. There wasn't going to be a single approach to this. But what we have built over the last few years is a design ecosystem. And so what we have through the Inclusive Beacons is a range of different design tools and methodologies that we bring to different problems. So we have everything from, a design cafe where people with disability can bring, where we again co-design and identify problems and barriers, and we work often with a person with disability facilitating and taking the lead on designing innovative solutions. Most of our design cafes will bring together research expertise, industry expertise, community expertise, and again, we're looking at having that shared set of perspectives in the room so that we can find solutions. We've also got a range of different approaches. So we run, design sprints, design jams that are more short and more intense sessions. We have a blend of in-person and also online approaches. And more recently, we've also been exploring the concept of citizen challenges, where members of our community can bring challenges and then be matched with a researcher, and again, that we're working through. So what's exciting is it's not just that the researchers are looking at what are the challenges of the regions and they're working, but it's also we've created space for community members to actually initiate and drive often design solutions. So again, it's very much a bottom up and also a cross-institutional approach. And that then links into next slide, the other piece of work, which is around how do we think about the importance of capability? And what's really interesting is that a lot of universities will think about capability and they'll think, how do we support capability internally? So you'll have, often within learning and teaching contexts, you'll have universal design workshops, you'll have, communities of practice that are often bringing academics, students, and professional staff together. What's really unique about what Griffith has done, and also what's happening in Queensland, Australia, is when we think about capability, we are not thinking just within the context of Griffith. Every time we think about capability, we're thinking, how do we do this in a way that's going to bring other universities and the sector together? So we have and have had for a long time in Australia, probably the most mature accessibility resources team. And it's a team that works in a dedicated way to develop accessible learning materials. What's unique, though, is that they're not just supporting accessible learning materials at Griffith, but they're also, as a team, supporting the University of Queensland, which is the university down the road, or QUT, which is the other university, and also TAFE and community. So we have an internal capacity within Griffith that we are then sharing across the sector. And we're doing the same. We were one of the first universities to have a deaf student support program where we have Ausland interpretation and support. And again, that team isn't just supporting Griffith students, it's actually supporting multi-cross institutional capability building. We also have a Citizen Research Essentials course, again, which is open to the public. And again, so when we think capability building, it's not just enough to measure success by how we're doing as an institution. We're looking at how do we measure success across. And in a time where we've got I think some considerable resourcing constraints where our budgets are getting smaller and smaller, what this approach to capability, which is really a sector community approach, has done is it's allowed, even while we're all facing constraints, it's allowed us to keep moving forward and having impact because we've got that shared approach. And what it's also doing is it's creating those informal learnings across institutions, and it's happening now by design rather than in offhanded moments where we come together for a conference. So that collaborative place-based approach, you can see how that's shaped our design ecosystem. It's shaped how we've thought about who's part of the research beacon, but it's also shaping, importantly, how we're doing the capability uplift. The other bit that we've been working on really intentionally is also, next slide, please, is we've also been thinking critically about our, that we want to design solutions, we want to understand the problems worth solving, but we also want to tackle things at a policy level because we were interested in how do we create long-term sustainable change. So Griffith, probably like most universities, has a disability access and inclusion plan. I'm really proud of how we've embedded it into a core driver for our vision. But the other bit is we've been looking at how do we now embed disability inclusion into all of our policies. And but how do we do that in a way that's actually responsive to the voices of our students? So Griffith is, I ended up at Griffith because I'm massively passionate about that vision of creating a brighter future for all. So we are a university that, similar to Arizona State, we want to measure our impact not by who we exclude, but by who we include. And one policy context that was a real pain point for our students is that at a lot of Australian universities, in order for students to get a reasonable adjustment, they have to have an access and inclusion plan. To get an access and inclusion plan, our students had to have the formal documentation and paperwork, which required our students to have the financial resources to often get the assessments that they need. And what we found at Griffith, and about we have over 5,000 students who identify and have let us know that they have disability. What we were finding is a lot of those students didn't necessarily have access to the assessments to get the documentation. And so we were finding that even though our policies, you could tick the box and say, yes, we have a robust approach around reasonable adjustments, but what we were finding is that those policies just were not accessible. So the policy and the lived experience were completely out of whack. So that then led to us doing a piece of work around, well, how do we rethink that? How do we create flexibility and access for the students who may not have the documentation? And so that's where we then did a rework of our policy ecosystem, and we moved from having a disability inclusion plan approach to shifting to a new approach where we've now implemented a positive service indicator. So students will come to Griffith, they will have an opportunity to self-identify as having a disability. They will then have access to meet with our access and inclusion team to assess what are their specific needs. And what is the functional impact of their disability. So we're focusing on the functional impact rather than on whether they have the paperwork. And then we work with them to understand what their needs are and what reasonable adjustments. And then they get a positive service indicator on their student tag. And that means then they have full access to the adjustments that they need. And for the cohort of students, what we have found is the majority are seeking reasonable adjustments that are not linked to compliance and legislative funding bodies. What that means now is more of our students can get access to the adjustments that they need, even if they don't have necessarily the paperwork. So if a student does need a resource that is linked to a compliance where there has to be documentation, we still have a mechanism to enable that. But what we are finding is the majority of our students don't actually require that functional don't necessarily have the functional impact to require resources. So that's a really good example of a policy ecosystem where, on the one hand, the Access Inclusion Plan was working for the students who could access it, but we've now shifted our policy environment to create more flexibility for those who, for various structural reasons, financial reasons, may not have the paperwork. So again, that's part of for us. And the reason we were able to do that, and that is because we had again, that partnership culture of the students not just being asked to give input, but really students co-designing solutions with us. The other bit is, and I've gone back to that, we've got a multi-sectional approach in Queensland. That's also been really significant around our policy advocacy at a national level. So when the Australian Universities Accord came out, there was literally silence on the needs of students with disability. But because we had this established ecosystem where we were used to working together around research, around policy, around resource and capability uplift, that meant that we were really well positioned to then advocate at a national level to have a rethink of our funding model. And I'm happy to report we went from having $13 million of funding to 53. So the impact of that intersectional approach and sector-wide thinking has been really transformative, both for capability, but also for the movements we've been able to make from a funding point of view. Final bit I just wanted to flag before I hand it over is next final slide is the other bit is one of our challenges that we were finding is we don't necessarily always have access to the data the data sets that we have. In the sector, we often have a lot of lag data. We often don't have the appropriate data. So another bit we've been working on is how do we get more real-time data and how do we activate not just institutional sector-wide data from student experience surveys or graduate outcomes surveys, but we've also embedded into our enrollment process every year a series of questions around employability where we know exactly where our students at in terms of their career plans. We ask students questions around their access to relevant work experience, but we also ask them their preferences around types of organizations they want to work with, where they want to work, and what disciplines. And again, we now have a data set that's specific for students with disabilities. So when we look at, okay, we've got disparity of graduate outcomes for students with disability, we're not just looking at a blank slate going, well, we don't know how to tackle this. We now have a real-time data set that we can activate to actually design more situated solutions with our students to tackle some of the challenges they're facing within the university around their employability, but externally. So I just want to wrap up. I think what I want to just emphasize is for us, disability inclusion cannot be decoupled from place. It has to be co-designed. And again, there's a lot of synergies with GOSIA, but I think the power of partnership across institutions, across sectors, and the impact that that can have at times of budget constraints. And when we've got a very volatile policy environment, it's really made a significant difference. So with that, I will pause and I will pass it back to Fariba for our final speaker.
Thanks so much, Caroline. Wonderful presentation, thank you. And just so many synergies, as you've already just outlined with Gosha's presentation, in terms of what I'm really hearing is that kind of self-advocacy, empowerment to overcome, certainly in the kind of policy barriers that you identified, is a real area of, I think, of strength, but also, really that person-based centered approach is really putting I guess the power back into those people who are being affected by certain policies or barriers that aren't allowing them to kind of access what they need. I was really interested as well in how you're working with other partner institutions and what impact that's having in the local ecosystem, and the ways in which you're able to advocate at the national level is really, that's really interesting. I think something that many of us as institutions, that kind of collective approach, can really learn from. So thank you, Caroline. I'm going to hand over to our next speaker. So that's Professor Anjum Halai. She's been appointed as the Vice Provost she was in November 2018. And she has a long-standing experience of working in the higher education sector in both Pakistan and internationally. Anjum has demonstrated strong leadership in building higher education institutions through establishing policy and governance systems, academic budget development, academic space management, and steering new academic initiatives and senior academic recruitment. Anjum is a member of our Access and Inclusion Working Group as well in the Higher Education Taskforce of the ACU. So I'd like to have a warm welcome for Professor Anjum Halai. Over to you.
Thank you very much, Fariba, for that introduction, and good day, colleagues, to all participants and attendees of this webinar. I have been invited to highlight the work of Aga Khan University in the arena of disability inclusion. So I'll start by giving a little bit of a background about the university and the context within which it works. So this, you can see, is the building where I'm currently sitting in Karachi, Pakistan. Next slide, please. Aga Khan University is relatively a young university. It's a private, not-for-profit university, founded in 1983 in Karachi, Pakistan, by our founding chancellor, Prince Karim Aga Khan. But as you can see from the map and from the list, that the university has campuses in 6 countries over 3 continents, and Pakistan being the principal campus and the longest serving in terms of its existence. The other campuses, Kenya, Tanzania, Uganda, Afghanistan, and United Kingdom. So majority of our campuses are in countries which can be characterized as low and middle income countries. And that's an important fact to understand about where the university is situated and what are some of the contextual factors that it needs to take into account. Next slide, please. So just to give a sense of the size of the university and what are its major programs. So we offer undergraduate, graduate, PhD programs largely in the health sciences and education, but we have also started offering programs in arts and humanities and social sciences. The list goes on the left-hand side, on my left-hand side of the slide. And then we currently have around 4,000 students, more than 17,000 employees and faculty, and we have awarded more than 21,000 degrees and diplomas over the 42 years or so that we have been around. So that's the size of our alumni. Next, please. So as I said, that the university works largely in low and middle income countries, and we need to understand the demographic dynamics of these countries or regions. If you look at Pakistan, it has a population of more than 241 million people, and a very large percentage of young population, 67% below 30 years of age. And yet, when it comes to access to basic education and to tertiary education, you can see tertiary education hovers between 12 and 13%, and we have 26 million children out of school. You look at sub-Saharan Africa, where Kenya, Tanzania, Uganda, all these campuses are located. And again, this region has a large population, a very sizable population of youth, and access to higher education stands at below 10%, and out-of-school children stand at 98 million. So access is a very big issue, be it basic education and then beyond basic education to tertiary education. And I'll come back to this issue in the context of what the university is doing. Next slide, please. So Aga Khan University, and I'm not focusing on the UK campus so much in this presentation. The UK campus is a very small program, a very small program, and also it's not a low and middle income country context. So what does the university do to enhance access? We have as our motto, the guiding principles in our motto are impact, quality, relevance, and access. Access is one of the 4 pillars, the guiding principles that the university really values. But of course, when we talk about access, then quality and relevance are integral to the kind of access that we provide. The campuses we make deliberate effort, policy effort, provision effort to reach and attract students from the most remote geographical regions. So for example, when I'm in Pakistan and I'm in the principal campus in Karachi, which is a very large city, but we also have outreach campuses in the very high mountainous remote regions where otherwise it would be very difficult for the youth and the population there to access. So the university has gone there. We have recently also launched a micro-credential program, which is an online and a hybrid program. Again, it offers a unique opportunity for access to those who are marginalized for a variety of reasons, for a range of reasons, including location, including disability. And I can say a little bit more on that in the discussion session. In the context where Aga Khan University is working, there is persistent gender inequity, and we take affirmative action policies and facilitative measures promote inclusion and participation of women, so that current statistics in the university stand at 2/3 of our students are women, 2/3 of our alumni are women, and half of our faculty members are women. And I mentioned earlier that we value quality, we value merit. Merit is an important condition, even in our admissions, etc. But we do not want to lose out the meritorious students because of poverty. So to ensure that the brightest of the poorest get access to the university and higher education, university provides financial assistance. And today, if we look at 80% of our students get financial assistance. So the point I want to make is that access, when it comes to issues of access, gender, location, poverty, and disability, they come together, they conflate. And I was looking at a study by Singhal. She had done her study in India and Pakistan about developments in education for disabled students. And her findings show that students who are disabled, children who are with disability are 10 times more likely not to be able to attend schools. So enhancing access for all of these reasons ensures that we are also including the disabled people into our net. Next slide, please. Now, yes, next slide. I don't know if yes, thank you. So I spoke about access and how gender, poverty, region, disability, they all come together in terms of posing barriers for access to higher education, and in these cases, even to basic education. So in the university, we have to operationalize our principle of access and inclusion, our motto, we have various policy and provision systems in place. The policy that I'm going to talk about here is the academic accommodation for students with disabilities. It specifically focuses on how to ensure and recognize that students with disabilities are a valuable human resource for the university. And the university needs to create an environment to provide them with equal opportunities and to protect their rights in full. Next slide, please. The policy has different components, and I'm not going to, the policy covers different components of university life, and I'm going to exemplify with examples how the policy provision gets operationalized in the course of the work of the university. So, next slide, please. It is important for the community in the university to have commitment, in this case, commitment to the values that it places on inclusion of those who are disabled. And that commitment should be seen to be coming from the top as well as permeate all sections of the university community. And two initiatives that I'd like to mention, which have been taken and supported very much by the president of the university's office, which is Office of Safe Disclosure. This office provides a system for deliberate reporting in good faith and for corrective measures, reporting issues of harassment or marginalization or any other challenge that members of the community might be facing, including the students who or the disabled in the university life. And one important feature of the Safe Disclosure system is a 24/7 hotline and online reporting system that provides a safe avenue for the members of the university community to report if they feel that they are being marginalized or they are not being provided the opportunity, because we know that those who are disabled are much more likely to be harassed, not even if inadvertently, and are much more likely to be left out from the opportunities that the university or life offers to the mainstream students. The other important initiative that the President's Office has taken relatively recently is creating an Office of Diversity, Equity, Inclusion, and Belonging. While the university faculty and the curricular departments work deliberately with the students and faculty, this office makes sure that all the members of the university community, it advocates fairness, justice, equity, and disability inclusion for all members of the community, be they in the other departments outside the academia. Yes, next slide, please. So I mentioned that I showed the university's policy on making accommodations for students with disability, and I did mention that that I will exemplify how the clauses of the policy are operationalized. So when it comes for youth applying to our undergraduate or graduate programs, the application portal has a section where they can declare their disability needs. Once they declare their, sometimes even if they require, not sometimes, but in all cases, when they declare their disability needs and then the university student office provides services for a needs analysis and needs assessments so that the program in the university can ensure and accommodate that the students have the necessary facilities available. So even though, as I mentioned earlier, that the admissions are merit-based, but students with disability are accepted and supported. In our Masters in Education program, for example, there have been multiple cases where students who were sight impaired were provided with materials in Braille or large font or other whatever technologically mediated solutions that were possible to enable these students to take part in the curricular work. In our health sciences program, for example, there was a student in nursing who needed hearing aids, and she was provided, who was using hearing aids, she was provided with a specialized stethoscope so that she could take part in her nursing practice in a meaningful way. The physical infrastructure, such as signage, access, they all in the university buildings, they observe the minimum requirements of the International Disability Code in architecture, planning, and design. Another issue that we face in the communities and contexts, and especially referring to the context where the university is working, is that it is often the society and the community looks at disability as a taboo topic and looks at disability as something not to be spoken about. In fact, Shingle's research that I mentioned earlier in India and Pakistan noted that where sometimes parents feel that they feel uncomfortable in disclosing the disability needs of their children. So in that case, it is important for community, for the university community to be exposed and to see and recognize students, youth with disability as valuable members of their community. Internships program in the university are offered to youth with Down syndrome, for example. This does not just open opportunity for children with youth with the Down syndrome, but it also creates an environment where other members of the university begin to accept the disabled as an important and part of the dynamics. Awareness raising seminars and film viewings are held regularly, and those also create aimed at education and awareness raising of the wider university community. Film viewing, for example, in our education campus include films which are focused on the issues that the disabled. They are films as such, but they are focused on disabled people. So Forrest Gump, for example, or Barfi was a local language film which focused on two youth who wanted to set up their life, but they were severely autistic. Next slide, please. We have a large examination board. It takes examinations for high-stakes school leaving examinations across the country. And the examination board, again, is when the schools register the students for the examination, they will table the additional requirements of students with disability, and the examination board of the university makes tailored arrangements for these students to ensure that their examination and evaluation is on their intellectual capacity, and they are not marginalized on the basis of the disability. So for example, for those with visual impairment or hearing impairment, or due to attention deficit disorder or other physical disability, students are provided customized support, including use of extra time for writing, use of scribes, separate examination rooms, and assistive technology as is appropriate for the need. Next, please. And we have 2 institutes for educational development. I mentioned earlier that education is a large program. And it is important in the education system to break the vicious cycle of exclusion of disabled students from the education process. And our education programs offer teacher education, especially pre-service teacher education, which includes integration of special needs as part of the curriculum framework. There are certificate courses which are being offered for teachers in pre-primary and lower primary to how to identify learners with neurodiversity and what would be the teaching strategies for them. I would like to share also an example of an alumni's impact in this arena, alumni from Aga Khan University's Institute for Educational Development. On the right-hand side, you see the image, a welcome note to Narjas Khatun School of Hearing Impairment. This is a school which is set up in the most remote northern mountainous part of the country. Sorry, there's a message. Am I out of time, Fariba?
Yes, sorry, Dr. Halliday. So I think we just need to wrap up very soon.
Yes, so just give me 2 minutes. So this school, for example, has been set up by a student of AKU who graduated. She set up this school currently because she had 2 hearing impaired daughters. She realized that nobody in that region would be able to provide her with education and opportunity for those young girls. And she has set up the school where currently now there are 10 teachers and close to 100 students. And this is the kind of role modeling impact also that the university has, because it works very much in close connection with the university to operationalize its principle and motto of inclusion and access. Thank you. I'll close here and would be very happy to take questions.
Thank you, Anjum, and thank you to all the speakers. I know that we have gone over time, but I really wanted to leave as much time as possible to hear from our speakers. What we've heard from 3 different, very diverse perspectives across different Commonwealth countries is how higher education institutions can become drivers of disability inclusion, and that's through policy change, through a co-design and partnership with different institutions as well as governments. And the data-driven innovation in Caroline's context, and practical action that Anjum and Gosha were also talking about in their and particularly in that kind of resource-constrained environment that Anjum was talking about. Really interesting, Anjum, as well, just to hear about the kind of the understanding of how different characteristics can actually exacerbate or kind of play out in terms of how you address inequity or inclusion. And without addressing one and ignoring the other, you need a kind of a holistic approach. And that's really important and something that I think is really played out in your presentation. I'll leave it here because I know that I have a number of different questions, but I think we've heard a lot in terms of the kind of contextual environments that each of you is working in. We will circulate the slides, and if there are further questions and you'd like to comment on or at least get in touch with any of the speakers, you're welcome to do that. We can facilitate that on your behalf. We do have, on behalf of a platform for ambassadors at your institutions to enable further dialogue around this in this space. So on behalf of the ACU, I really want to thank each of our speakers for your insights, and for those of you who have joined us from across different sectors and countries, thank you for your time and engagement. As I said earlier, this webinar is part of a series of wider series on access and inclusion, and we will feed the kind of the contributions as well as some of the dialogue around this into our higher education task force recommendations and what we take to heads of government in 2027. And just before we wrap up, I just wanted to insert a plug for our annual ACU Congress, which is happening in November in Nairobi, and that's aimed at institutional leaders, of which ambassadors are also welcome to attend. We'll circulate a link to register for that event in our forthcoming email that will follow. Please do register as early as possible to obtain the early bird discount as well. So once again, thank you for your time today, and we'd love to hear your feedback, so do fill out our survey as well. Take care and goodbye.